Welcome to the Guide to AAIC series. These guides are meant to help you put your best foot forward with your Alzheimer's Association's International Conference submission and to also help optimize your AAIC experience. This webinar, I will be speaking a little bit about reviewing abstracts for AAIC. In the review process, we ask reviewers to consider both the scientific interest and quality of every submission. This includes if the abstract is relevant to the conference, asking the question, does the background section provide sufficient information and set the stage of the study? Are the methods well designed and appropriate? Does the abstract contain results? Noting that reviewers can still rate an abstract highly if of interest if it does not have any results. Are the conclusions or implications well justified? Is the abstract written clearly and organized well? And is the abstract non-commercial in nature? Once the reviewer has read through the abstract, we then ask reviewers to assign scores between 1 and 4. 1 being reject, 2 being accepted as a poster presentation, 3 meaning it could go either as a poster or an oral presentation, and 4 is to recommend acceptance of it as an oral presentation. All abstracts are sent to 5 reviewers to grade every submitted abstract within a various research topic. Each reviewer receives approximately 20 to 40 abstracts, and the scores and comments are passed along to the Scientific Program Committee theme members. If you have a conflict of interest or don't feel qualified to review a certain abstract, you are able to mark I must abstain from scoring this particular abstract. All the reviews and scores that are sent to the planning committee are anonymized, so your review will remain anonymous as it goes to the committee for them to review all abstracts. So now that we've walked through the review process for individual abstracts, let's move on to session submissions. So to give you a reminder on what comprises a featured research session or a perspective session, the FRSs are bringing together multiple research findings around a central topic. They're going to be 90 minutes in length. There will be 2 chairs and 4 to 6 presenters, and they will have structured abstracts, which can be any from the original, updated, or encore categories. When reviewing these sessions, please keep in mind that we discuss what we discussed for individual abstracts, really focusing on scientific integrity and quality. For the perspective sessions, these provide both a review of recent advances and a roadmap for future directions. So by presenting a more narrative structure for the audience to follow, these perspective sessions are meant to provide an entry point for audience members who may be coming from other fields of expertise. Like the FRS sessions, perspectives are 90 minutes, have 2 chairs, and 4 to 6 presentations that are drawing upon the same categories. The key difference between these 2 groups is that perspective presenters have all submitted unstructured abstracts, which does not require them having specific methods, results, or conclusion sections. And like the FRS sections, please keep in mind scientific interest and quality when reviewing the submitted abstracts. Now for the clinical toolbox sessions. This is a series for clinicians. These could be focused on topics such as the diagnosis of vascular dementia or behavioral treatments for agitation. These may include different clinical specialties, such as for primary care physicians or neurologists or neuropsychologists, as well as caregivers. These sessions can range from 45 minutes to 90 minutes in length, also comprise 2 chairs and 4 to 6 presenters. Each presentation is an unstructured abstract, and similarly to the others, we ask reviewers to consider the scientific integrity of scientific interest and quality of all abstracts submitted. So when we zoom out and really focus more on the bigger picture of these sessions that are being submitted, there are things to consider, like the importance and timeliness of the topic, cohesiveness and balance of the abstracts, the chairs and the presenters, These will be visible to the reviewers. The reason you have access to the list of chairs and presenters is because it's really important to have sessions that have diverse perspectives. Diversity in terms of scientific perspectives, bringing together researchers with different expertise, diversity in terms of demographics. If a submission has 4 presenters of the same gender from the same country, it is unlikely to be rated highly. And it needs to bring together highlighting various topics to a global audience. So when you are reviewing the session as a whole, you'll be able to score it as a whole with reject, low priority to accept, medium priority to accept, and high priority to accept. Abstracts and session scores are combined to result in an overall rating for a session, and that is also passed along to the planning committee anonymously, along with any comments that are given from the reviewers. Throughout this, leaving comments is really important. So please be sure to leave your thoughts as you review any abstracts or sessions for AAIC. And finally, want to briefly talk about the review process in a big picture. Because the FRS and perspectives are both reviewed at an abstract level and at a session level, we may run into a situation where a session may not be rated highly as a whole, but it contains an abstract that maybe stood out to reviewers. To account for this situation, abstracts within an unaccepted FRS or perspective automatically can get transferred into our main abstract pool and can be considered for individual presentations by the scientific program committee. This method ensures that submitters have the best possible chance to have their research displayed at AAIC. So as you can see, the sessions will either be accepted or transferred into that individual abstract bucket of oral, poster, or rejected. That is an overview of the review process for AAIC. Thank you very much.